Welcome back to the morning show here on Arise News.
Health is a lifestyle choice. The everyday decisions you make will determine how healthy you will be in the future. Joining us to discuss the 3 pillars of health is Adesimbo Ukiri, the Managing Director and CEO of Avon Healthcare Limited. Adesimbo is a passionate healthcare advocate who has spoken internationally on topics such as moving the needle on healthcare financing, the future market for health coverage, and accelerating the journey to universal health coverage. She features as a contributing resource person for global organizations, inclusive but not limited to the International Finance Corporation, IFC, the World Health Organization, and the Corporate Council on Africa. Welcome to the morning show, Adesimbo.
Good morning, Adesimbo.
Good morning. Thank you. It's a pleasure to be here.
Yes, it's amazing that you have all of these awards and things going on for you. Well done.
Thank you.
Well done. Okay, let's talk about your healthcare. I know you're not only into health, you're also a lawyer as well. Yeah. How did you transition from that to healthcare?
You're right. I initially trained as a lawyer,
okay.
And but since then I've moved into various sectors, you know, of the economy. I've also worked in finance. I've worked in FMCG, fast-moving consumer goods. I've also worked in telecoms as well. But throughout, you know, all this, you know, career sort of journey, I have discovered that my passion is really to be there when an industry is about to take off.
Okay.
And to also be at the forefront of creating awareness and driving business growth. Health is something that's really, really also important. You know, I like to work in sectors of the industry that is going to impact a large number of people and, of course, bring positive outcomes. You know, so health was a natural next choice for me.
Wow, that's brilliant.
Well, you run an HMO. Which area are you in? I mean, what kind of service do you provide? Is it community-based, or, you know, what really is, or you only, you know, provide service for VIPs?
No, not at all, not at all. In fact, our mantra in Avon HMO is that we're here to empower all Nigerians to live healthier, fuller lives. And one of the ways in which we do that is to give access to healthcare services to everyone. You know, we believe no matter what your social status, your income level is, you should be able to have access to healthcare when you need it and not, you know, be bankrupt or be unable to have access just because you can't afford it.
Well, but I know some HMOs specialize.
Yes.
Some only do companies and government workers. Some do students. Some deal with market women and all of that. So I was asking you whether you have a specialty.
No, we do not discriminate in any way. We are able to provide healthcare to all Nigerians. We do that to people who have come together as an association or as a group. We do that individually to anyone. Right now, you know, we actually were the first HMO to go after what we call the Nigerian individual, the retail market, the informal sector of the market. So before we came into existence in 2013, most HMOs just, like you said, focused on the corporate segment, you know, all the large companies in Nigeria. And also, prior to that, they all started off with federal government civil servants on the NHIS. But we came in and we realized that, gosh, we have a country of over 180 million people.
And you cover over 36 states in Nigeria.
We are in every single state.
And you're also looking internationally as well.
Yes,
are you international? Or is it that we are here and we can use it internationally?
No,
what does that mean?
We're here and we can provide you cover internationally as well.
What kind of coverage do you have internationally?
So we have covers that are limited to just Africa.
Okay.
Well, we start from home, Nigeria. So if you are within Nigeria, we provide you cover across Nigeria.
Okay.
If you also just intend to travel only within Africa as a continent, we have an option of providing you with a cover that also covers the rest of Africa. The next level after that is a level of cover that covers you in Africa as well as in Asia, particularly India.
Oh, I see. So right now it's just Africa.
No. We have beyond Africa as well, and then we have global.
Okay.
And then we have also, when I say global, I mean all the other parts of the world outside of the US.
Yes.
US is also possible, but at a different plan and at a different cost.
Okay, so let's say I have your plan, your individual plan. right? And I just find myself in England, correct? And I have to go to an emergency room. Will that cover that?
That will certainly cover that.
Okay.
Well, what's your assessment of the market? I mean, if you look around, many Nigerians still do out-of-pocket health financing. And you should know that. You've given a lecture on health financing before. You know, how do you think we can get more people into the net? Because the out-of-pocket thing has been a problem, and that's why, you know, the HMO policy came up in the first place. What has been your experience?
My experience is that we need to stop trying to sell health plans and first educate Nigerians. The focus has, if we don't, you know, get Nigerians to start thinking about their health as, you know, a lifestyle choice. That's what I really want every Nigerian to know. What you do to your health now determines the quality of life you're going to have in the future. And most Nigerians only think about their health when something catastrophic happens. Never before. And that's what I think.
Well, we believe in God. We are very religious.
Indeed we do.
We say God is in charge.
Indeed we do. Indeed we do. That is what we experience. That's why it's been so hard to crack this market. But first, we must start with the basics. That is, what are you doing about your health now to make sure that you have secured it for the future? I mean, I can look at you now and ask you how many hours of sleep you get a day, for instance. What kind of physical activity do you participating on a daily basis? What kind of food do you eat? You know, if we are not conscious of all the health risks that are out there and what could be going on in our bodies, then we will not think to get a health plan. So let us have a conversation about how conscious are Nigerians about their health, how much knowledge do they have about what is going on in their bodies, and how do they know the implications of their daily activities and their daily decisions on their health. So these are your 3
pillars on
These
on
are
health.
the 3 pillars of health. What do you eat? When do you eat it? How much physical activity do you do in a day? Or in a week?
The average Nigerian will tell you something must kill man anyway.
No, when do you want to be killed and how much do you want to spend before you go?
Right. So, you know, many Nigerians are big on self-medication, you know. So how do we address that issue with the self-medication?
Yeah, that is one of the things that we talk about when we tell people, invest in your health by also subscribing to a health plan. We do want you to subscribe to a health plan at the end of the day. Yeah. But first, we want you to understand the kind of health risks that are out there and what you are probably exposing yourself to without understanding it. Because if you had a health plan, you wouldn't think twice about going into a hospital. The reason why most people will self-medicate is they think about, oh, the hospital is going to charge me tens of thousands of naira for something that is probably a malaria. And they walk into a pharmacist or a medicine store and they buy a malaria, some tablets for malaria and treat themselves. Meanwhile, it might, and I have a personal experience about this, I felt feverish and I was very busy on that day and I told my staff, you know what, I think, maybe I'd better just take something. And they said, practice what you preach.
But the cost of healthcare in Nigeria is very high.
I was just going to ask you, how affordable?
And even for registration, to register with an HMO, you pay between 9,000 or 15,000. Right. Just mere registration, the registration form alone. Isn't that too high?
Correct.
Shouldn't you guys make it like 1,500 to attract people?
This is an excellent opportunity to talk about what we do. There's no registration with an HMO, absolutely not. Okay. What you do is you subscribe to a health plan, and everybody has a choice of choosing the health plan that best suits their age, the kind of health risks they face, as well as their pocket and the level of hospitals they want to have access to. Now, we have a rule that no matter which hospital you have access to, the clinical quality must be the same. Now, the bells and the whistles can be different. So you could have a hospital that has a private room and has a TV with DSTV, or you could also have a hospital that would have a radio, but the clinical outcome must be of the same quality. Now, people can subscribe to a health plan for as little as 20,000 naira.
Okay.
And that 20,000 naira will cover what we call GOPD, all the general outpatient consultations. You don't need to pay anything when you're going to see a doctor for malaria, for even the drugs. You don't need to pay anything. Upper respiratory infection, typhoid, all the common things we all go to the hospital for. In addition to that, even minor and intermediate surgeries are covered. So God forbid you have the need for an appendectomy, it's covered. You wouldn't have to pay.
I'm impressed. I mean,
You-
you're a lawyer. Did you study medicine too? I mean, you seem to have. Because, but I know that anybody can invest.
Yeah.
Oh, you have a degree in medicine?
No, not in medicine.
In business and in law as well.
I have a degree. I have a
Can you
master's
share
in
your
business.
social media real quick?
Yes, please go to Avon at Avon HMO. That's our handle on Twitter. It's also at Avon HMO on Instagram, and we are Avon HMO on Facebook. So just go Avon HMO and you'll find us there.
You've been asking every guest to give their email address.
Well, that's what we do.
That's advertisement, isn't it?
It's very exciting for us too, because we understand that, you know, to reach millions of Nigerians and the way we have ambitions to, we can't do that through brick and mortar.
Yeah.
The time for that is far gone. You know,
Anyway, thank you very much,
Thank you
Simbo.
so much.
We've got to go. Well, that brings us to the end of the morning show today. Thank you for watching. From our entire team here in Lagos, enjoy the rest of your morning and, of course, the rest of your day.
Goodbye.
Goodbye.